Hey, good morning, everyone, or good day. So, to continue our discussion in radiation protection, so last time we have discussed the different sources of radiation exposure. So, this time, we will discuss naman the justification for radiation protection. Of course, just like what I have been mentioning, uh, when we use radiation, specifically ionizing radiation for diagnostic or either therapeutic purposes, of course, there will always be risks. Since gumagamit tayo ng ionizing radiation, so kumbaga parang matik na siya na magkakaroon ng possible side effects, bad effects, or risks sa patients. Actually, hindi lang sa patients, kahit sa ating mga radiation workers, sa ating mga rad techs, and also to the general public. That is why we need to ensure na kapag magpe-perform tayo ng any, kahit anong radiographic examination, we should see to it na dapat yung ating examinations will always be justified. So kapag sinasabi nating justification of practices or justification for radiation protection, so dapat isipin natin na the benefits must always outweigh the risks. Benefits versus risks. And dapat mas lamang lagi si benefits. Kasi nga 'di ba, sabi ko nga na laging may risk 'yan. Kahit anong examinations, kahit chest x-ray pa 'yan. So laging may risk dahil nga sa ionizing radiation. Pero we need to ensure na laging lamang yung mga benefits na makukuha natin when performing that specific radiographic examinations. And how can we ensure na justified yung examination? Of course, yung pinakauna nating tinitingnan para ma-ensure natin na sa bawat radiographic examinations na gagawin natin is that titingnan natin kung merong request from the physician or from the doctor of the patient. So, kapag may request, automatic, ibig sabihin, justified siya. Kasi, kumbaga, na-evaluate na siya ng doktor. And the doctor have already decided na yung patient na mag-undergo halimbawa ng chest x-ray, ibig sabihin, kailangan siya talagang gawin. Kasi yun yung gusto ng doktor na makita yung kanyang structures through x-rays. Yun, yung pinakaunang-unang step na magagawa natin to ensure na what we're going to do is justified. That is by looking for or asking the patient for a request form to perform the examinations. Kasi yun nga mga nabanggit ko rin dati na may mga pasyente na nai-stress lang dahil halimbawa sa kaka-review sa exam, nai-stress sila, sumasakit yung ulo, or baka naman heartbroken, so hindi maganda yung pakiramdam, magpapa-x-ray, magpapa-CT scan, magpapa-MRI, and other imaging modalities. So that those were not justified. So kailangan dumaan muna sila sa doktor, ay halimbawa, baka itanong nyo, paano yan, Doc? If halimbawa, na-stress lang siya, tapos pumunta siya sa doktor, and then, pumayag naman yung doktor, binigyan siya ng request. So, justified pa rin ba? So, that will be justified in terms of legality kasi the doctor is the one that assess the patient. Ibig sabihin, dahil na-assess siya ng doktor, nabigyan siya ng request dahil sa tingin ng doktor, kailangan niya mag-undergo sa examination na yon kasi nga, kailangan ng doktor mag-evaluate kung ano man yung napag-usapan nila doon, di ba? So, kapag may request, wala na tayong Kumbaga, hindi na tayo makakapalag doon. Susundin natin yon. Unless, may mga instances, halimbawa, yung request is, let's say, left arm. Tapos yung nakita mo yung fracture niya nasa right. So yun, pwede tayong tanong sa doktor kung clarify. Sabihin natin, siyempre, in a nice manner. Doc, I have observed po kasi na yung fracture ni patient nasa right, pero yung nakalagay po sa request is left. So, ito po ba yun? Ko-confirm ko lang po. So, yung ganon, pwede tayong magtanong. Pero, in general, kapag hindi naman ganon yung case, halimbawa, may request ng chest x-ray or skull PA, or kung ano man yung request ng doktor, kung wala namang anomaly na ma-observe kayo, so you just need to follow the doctor's request. Okay? So again, kailangan talaga laging may justification of performing bago mag-perform ng radiographic examinations. And in this case, we will going to discuss the importance of justification for radiation protection. So bakit kailangan natin i-observe na i-protect to ensure na i-protect natin yung patients, yung ating mga colleagues, yung mga radtechs, other health workers, and general public from the hazards of radiation exposure. Because, again, paulit-ulit kong sinasabi, when we are using ionizing radiation, either for diagnostic or therapeutic purposes, there will always be risks. And these risks can lead to either somatic or genetic effects. The effects of radiation on human population can be classified either as somatic or genetic. So somatic effects are harm or effects exposed individuals suffering during their lifetime. So, such as radiation-induced cancers, sterility, opacification of the eye lens, which is the cataracts, and life shortening. What genetic or hereditary effects? These are radiation-induced mutations to an individual's genes and DNA that can contribute to the birth of defective descendants. So again, to simplify things, ano yung pinagkaiba ng somatic and ng genetic effects? Halimbawa, ako yung na-expose sa high doses of radiation. And then, nagkaroon ako ngayon ng signs and symptoms, nagsuka, nagtae, sumakit yung ulo, and then, nagkaroon ng skin erythema, or later, pwedeng nagkaroon ako ng cancer, radiation-induced cancer, na naging sterile, or nagkaroon ng cataract, that is somatic effects. Whereas, pag sinabi natin genetic effects, ako mismo na na-expose sa high doses of radiation, wala akong kahit isang signs and symptoms of radiation exposure. Pero later, kapag nagkaanak ako, nagkaapo ako, and then they suffered from mutations, halimbawa, nagkaroon sila ng problema, nagka-cancer sila, or diminished growth and development, naging abnormal yung mental state nila. So that is a genetic effect. So again, somatic, kung mismo yung na-expose, ako rin yung magsasuffer. Genetic, ako yung na-expose, yung nag-suffer naman is yung descendants. Okay? So, yun yung ibig sabihin ng ating somatic and genetic effects. So, somatic and genetic effects. So, under somatic effects, so pwede siyang late effects or early effects. So, nangyayari ang late effects when receiving low doses of radiation. And these late effects also follows what we call the stochastic effects. So stochastic effects or late effects, this can happen, this may not. Hindi pwede siyang mangyari, pwedeng hindi. Halimbawa ng cancer, pwedeng magka-cancer later, pwede rin namang hindi. So, kumbaga, swertehan yun eh. Swertehan yun. While for early effects, these are also called deterministic effects. Deterministic. So, once na-abot or na-exceed yung tinatawag natin na threshold, mangyayari yung early effects. Pinaka-common effect is your skin erythema. So, skin erythema. So, erythema. So, skin erythema refers to the sunburn light. Para siyang sunburn. Sunburn like reddening of the skin. This is the most common somatic early effects or deterministic effects. So again, pag sinabi nating early effects, so once the threshold dose will be exceeded, automatic magkakaroon ng early effects. Dito naman sa somatic late effects or sa stochastic effects, maabot man or hindi yung dose, kumbaga regardless of the dose, any amount of dose. Ito siya, any amount of dose will probably result to late effects. So again, pag sinabi natin probably, law of chance. So, law of chance. Regardless of the dose, taas man or mababa yung dose na na-receive, pwedeng magkaroon ng cancer, pwede ding hindi. Sa somatic early effects or sa deterministic effects, once naabot or na-exceed, nalagpasan yung threshold dose, automatic magkakaroon ng early effects. Halimbawa, pag the patient receives 200 rad sa specific or sa local tissue, halimbawa sa arms niya, kapag naka-receive ng 200 rad radiation dose, automatic magkakaroon ng skin erythema. Ito yung threshold kasi niya eh. So, hanggang dyan lang, pag magpas sa 200, automatic magkakaroon ng skin erythema. Pero, pag hindi naman siya umabot sa 200, halimbawa 199, so walang skin erythema na nangyayari. Sa somatic, kahit 0.01 pa yan. Kung tiyempo mo, kung natsambahan ka, so sorry. Pag hindi, edi ikaw na. Diba? Ganun yun. So, naintindihan. Sana naintindihan. Stochastic, pwedeng mangyari, pwedeng hindi, regardless of the dose. It is independent of the dose. While deterministic or the early effects, once the threshold dose is exceeded, nalagpasan yung limit, yung threshold dose, automatic, the early effects or the deterministic effects will occur. For somatic effects na late effects or stochastic, so nahahati siya sa non-malignant and sa malignant late effects. So pag sinabi natin malignant, ito yung mga cancers. Kapag nagkaroon ng cancer, radiation-induced cancer, so that is referred to as malignant late effects. Pero halimbawa, yung pasyente suffered from late effects din siya, halimbawa cataracts or opacification sa lens of the eyes, that is non-malignant. Pero late effects pa din. Okay? So, genetic, so usually, siya, late effect siya. Siyempre, hindi naman tayo yung expose ang nagkaroon ng signs and symptoms, but our offsprings which will occur later, so late effect siya. Okay? So, yung somatic, pwedeng early, pwedeng late. Yung genetic, late effects.
Welcome.
The next for potential biological damage of ionizing radiation. So, once the patient receives a certain amount of radiation, so pwedeng magkaroon ng biological damage or epekto sa katawan natin. And they are divided into two, the stochastic and the non-stochastic. Pag sinabi natin stochastic, so this is also referred to as the probability effects. Pag non-stochastic, this is referred to also as the non-probability. Probability. So, pag sinabi nating probability, by chance. Okay? So, pwedeng mangyari, pwede rin namang hindi. Pag non-stochastic, so non-probable siya. Kasi, once na ma-exceed ang threshold dose, mangyayari yung effects. Okay? So, parang pareho rin siya ng late effects and early effects. Continue. So, we have here different effects of radiation exposure to humans. So, for deterministic, so again, nangyayari yung deterministic if the threshold dose is exceeded. So, different amount of doses will also result to different early or deterministic or non-stochastic effects. For example, acute radiation syndrome, under niya, hematologic syndrome, GM syndrome, and CNS syndrome. Pag sinabi nating ARS, or acute radiation syndrome, yung keywords ni dito, it is defined as the sequence of events that will happen after receiving high doses of radiation. So, ibig sabihin ng ARS or ng acute radiation syndrome, once a person receives high doses of radiation, so he will undergo sequence of events. So, pag sinabi natin sequence of events, so it is in chronological order. So, magkakasunod yan, step by step. Okay? So, it is divided into different stages, which are the prodromal, the latent, prodromal, latent, and manifest period. So these are the stages. That the person exposed will experience. So, pag prodromal, so kapag this is the first signs and symptoms, na mai-experience ng patient like nausea, vomiting, diarrhea. And then for latent period, so mga mild symptoms pa lang siya. And then after experiencing mild symptoms, so latent period will happen. So latent period is described where the person exposed is free of visible effects. So, ibig sabihin, during this period, so usually napagkakamalan siya na okay na si patient. Okay na yung tao na na-expose sa radiation kasi wala na siyang signs and symptoms. But wait, there's more. So, hindi ibig sabihin na wala na siyang signs and symptoms ay okay na siya. Akala niya lang yon, pero hindi pala. Yun, nahopya lang siya. Because, totoo naman, pwedeng okay na siya talaga kung hindi naman ganun ka very, very high yung dose received. Pero kapag masyadong mataas yung dose received niya or baka kahit mababa pero natsambahan siya. So after ng latent, babalik lahat ng signs and symptoms na naranasan niya sa prodromal stage plus other complications. Ito yung pinakamalala. Okay? So, the length of time that the person will experience each stage will depend on the amount of dose received. Again, kung gaano katagal mai-experience ng pasyente yung prodromal, kung gaano siya katagal sa latent or sa latent, o kung gaano siya katagal or kaigsi lang yung experience niya sa manifest will again depend on the amount of dose received. So, for lower doses, hindi naman siya yung very low. For lower doses, tatagal siya per stage. So, it will also entail longer stage or longer time for each stages. Pag mataas naman, pag higher dose, shorter time that the individual will experience per stage. Halimbawa, pag lower, so sa prodromal, halimbawa, 30 days siya na experience. Yung latent niya is, let's say, 15 days. Yung manifest naman niya will be, let's say, 10 days. For lower. So this is just an example just to explain further kung ano sinasabi kong dependent siya sa dose. Pag high naman, ang dose na receive sa prodromal, pwede hanggang 10 days lang siya. Sa latent, let's say, lang siya, 1 day. Then sa manifest, 3 hours lang. The higher the dose received, so higher dose will result to shorter time for each stages. Kasi mabilis lang yung effect sa kanya in a matter of, let's say, in a matter of 24 hours, maaaring mamatay sa patient. Kung kahit ganun yung nangyari, the patient still has undergone these 3 stages. Walang skip. Dapat pagdaan lahat yan ng pasyente, pero paiksi yung time. While if the dose received is lower, so longer naman. So longer time spent for each stages. Okay? So is clear. Actually, mas detailed siyang i-discuss sa radiobiology ninyo. So for local tissue damage, so early effects, skin erythema. Sa gonads, pwedeng temporary or permanent sterility. Sa extremities, pwedeng damage sa upper extremities kung ano yung part ng exposed or pwede din sa lower extremities. Hematologic depression, so pwede rin siyang mangyari as early as possible kapag naka-receive ng high doses of radiation, bababa yung blood count. And this can result to infection and electrolyte imbalance. For cytogenetic damage naman, so of course, from the name itself, the damage affect the genes or the cells. So again, nangyayari ang deterministic or early effects when a person receives high dose of radiation. For stochastic effects of radiation in humans, so nangyayari naman siya if low dose. Weak effect siya. Yung mga radiation-induced malignancies like leukemia, bone, lung, thyroid, and breast cancer. Meron ding late effects para sa skin, like skin cancer. Pwede rito, permanent sterility, and then cataracts. Then pwede rin mangyari, long-term, shortening of lifespan. So, being eradicated, the life lost is 12 days. For the lifespan na siya. So, being in lab tech, so we may last 12 days, is according to researchers' estimates. Then, genetic damage, of course, this is late effects. So, yung effect ay mararamdaman ng offsprings or ng descendants. So, damage sa genes, doubling dose. So, yung amount ng dose na will result to mas extreme side effects. Parang dinoble yung dose ng receive ng patient. And the genetically significant dose or the GSD, which can affect the genes or the offsprings then. So aside from early and late effects, so mayroon ding effects sa irradiation. So it can affect the fetus exposed during pregnancy, pwedeng prenatal death. So before birth, neonatal, bagong panganak, so newborn birth, congenital malformation, childhood malignancy, and diminished growth and development. So this can be the effects of radiation exposure to humans, whether receiving high or low doses of radiation. There are two types of biological effects as mentioned kanina. We have the stochastic and non-stochastic. So stochastic effects occur by law of chance or probability. So nabanggit ko na rin to kanina. Regardless of the dose, mataas man yan o mababa kapag nagtsambahan ka, sorry. So it can cause cancer. And at the same time, it can affect the descendants by affecting the gene material, affecting future generations. So again, this is late effects or the probability effects. Another one is deterministic effects or the non-stochastic or non-probability. As I have mentioned, nangyayari lang siya kapag nakaka-receive tayo ng mataas na doses of radiation and when the threshold dose is exceeded. Again, pag sinabi natin threshold dose, yung pinaka-limit, pinaka-kota. So, for example, 300 rad, pag na-exceed siya, so this will result to epilation or temporary loss of hair. 200 rad sa local tissue, this can result to skin erythema. Pag hindi naman umabot sa 300, so walang epilation. Pag hindi umabot sa 200 rad, walang erythema. So ito yung mga threshold dose. By the way, pag sinabi natin epilation, so temporary So the loss of hair temporarily can occur in either parts of the body, kahit saang parte ng katawan. Epilation ang tawag. While pag sinabing alopecia, so temporary loss of hair din siya, pero sa ulo lang, sa ulo niya. So for deterministic, so as the dose increases, deterministic effects also increases. So directly related. So this can result to skin erythema, so epilation, cataracts, temporary and permanent sterility. Ito siya, pag deterministic, pag hindi umabot sa threshold dose, so the effect will not occur. Pero kapag nag-exceed, so effects can occur. Then for deterministic and stochastic, so deterministic again, pag hindi siya lumagpas dito sa threshold, so wala siyang effect. Pero pag lumagpas sa threshold, so there is deterministic effects. Whereas for stochastic effects naman, so surprise. So pag magulat ka, pwedeng wala rin. Okay? So I hope na intindihan. So if you have questions or concerns or you want to clarify something, so you can just message me to ask. So in the meantime, so ito na muna yung ating topic for today's video.